Hi guys. Hey, today I want to talk about pain with rehab exercises or pain during recovery from injury. One of the questions I get asked a lot when I work with people is if their rehab exercises, their exercise after an injury should be painful or not. And number two, is it okay? I mean, are they going to injure themselves more? So what I find is that many people who have been struggling with off and on pain or recovery from an injury for a longer period of time have many times tried to get back into exercise or tried to do some rehab exercises and experienced increased pain and then stopped. And what this leads to is that they eventually start cutting out a lot of their activities until they're not doing anything that they enjoy and they're not doing any of the exercises that might benefit them. So I guess when I go to answer this question, in general, what I'll tell you is it really just depends on the acuity or how soon you injured yourself. So if you just injured yourself, within a week or a couple of days ago, of course you're going to want to take it easy and let the symptoms come down, or even a couple of weeks back off on everything. But what I see here is a lot of people who have had pain and symptoms for months, longer than what the tissue recovery would normally take, and they're still not able to get back to doing what they want. So in those situations, what I try to communicate to people is that having some discomfort during the exercises is okay. And actually there's some research on tendonitis type problems that actually having pain may be beneficial. But the important thing is that I work with patients to set the parameters, like how much pain is okay to experience. And then what are your symptoms like afterwards? We want to try to get people progressing even with a little bit of pain, but also we want to prevent big flare-ups the next days. So the key with recovery is consistency, being able to do stuff and be active and load the tissues or stretch the tissues consistently day to day and not have big spikes in pain where one day you do a whole lot and the next few days you can't do anything because you're too sore. So really it's very individual instructions that people need and that I give them, but in general, the longer you've had the pain, the safer it is to exercise with some pain, with parameters set in place to guide you that are based on your individual situation. So if you've been struggling to get over an injury, things hurt when you try to do stuff with the injured part, and I feel like you're kind of stuck, go ahead and reach out to me. And I'd be happy to try to help you get over your situation and get back to being healthy. Thanks.